A wise man once said that if humans live long enough, everyone will eventually develop cancer. The current lifetime risk of getting cancer is about 40%, and dying from cancer is about 20%. So that means that cancers affect the life of millions of people all over the world every year. Of all cancer types, pancreatic ductal adenocarcinoma is one of the deadliest types of cancers. It currently stands at number 4 in terms of cancer deaths every year, with the survival rate of roughly between 6 to 7%, with most people actually dying within the first year of getting this type of cancer. The current treatments of pancreatic cancer include radiotherapy, surgery, and chemotherapy, with surgery being the most effective treatment. However, a lot of patients are not even eligible for surgery due to the metastatic nature of pancreatic cancer. For those patients, we use chemoradiation. However, even chemoradiation does suffer from some problems, mainly normal tissue toxicity. So we are proposing incorporating nanotechnology into the treatment of pancreatic cancer. Nanoparticles could be used as radiosensitizers in radiotherapy and as drug carriers in chemotherapy for a combined chemo-nano-radiotherapy treatment. The hypothesis is that the small size of these nanoparticles would allow them to accumulate more in the tumor through taking advantage of the enhanced permeability and retention effect due to their small size. So they will accumulate more in the tumor as opposed to normal tissues. Thus, they will have lower normal tissue toxicity. For our radiosensitizers, we are planning to use gold nanoparticles. Gold nanoparticles has been tested clinically using MeV radiation, which is being used in all cancer treatment centers. The idea of how gold nanoparticles work as radiosensitizers is that when the gold nanoparticle absorb the photons, they emit electrons. Those electrons deposit their energy in the water in the cells. That will cause the production of free radicals, which will cause the DNA to get damaged, usually in the form of DNA double-strand break damages that usually leads to the cancer cells to die. But why are we using gold nanoparticles specifically? Gold nanoparticles have low toxicity in general. They could easily be produced as we produce them within about 30 minutes in the lab for the specific size that we want. Their surface chemistry is really versatile. They could be, we could attach different molecules and peptides to the nanoparticle to allow them to have better circulation in the body as well as have better tumor targeting. Also, the nanoparticles are really versatile in the sense that they could be used for therapeutic purposes as well as imaging purposes. In terms of the chemotherapeutic drug that we are proposing to use, it's called docetaxel. It's an FDA-approved drug that is being used for the treatment of different types of cancers, including head and neck and prostate. The advantage of this type of chemotherapeutic drug is that it does interfere with the cell cycle. Specifically, it does trap the cell in the most radiosensitive phase, which is the G2M phase. And it does that by interfering with the assembly of the microtubules inside the cells. And microtubules are like highways that transport cargoes inside the living cell. So what happens when we use gold nanoparticles with docetaxel together? We have done actually multiple in vivo and in vitro experiments using docetaxel with gold. When we do not use docetaxel, the gold nanoparticles enter the cell through endocytosis, and then they move along the microtubules before leaving the cell through exocytosis after a few days. When we do use docetaxel, what happens is that the gold nanoparticles get trapped inside the cells because the microtubule assembly is damaged in a way that doesn't help the nanoparticle reach the periphery of the cell and then leave the cell through exocytosis. So we found out that the retention of gold nanoparticles inside cells that has docetaxel increases dramatically. However, docetaxel is actually toxic to normal tissues. So how do we overcome that problem? We are proposing using docetaxel prodrug lipid nanoparticle system. This lipid nanoparticle system is made of a lipid layer with the docetaxel encapsulated in a hydrophobic pocket because docetaxel is not water soluble. These lipid nanoparticles are made of organic material that helps the nanoparticle circulate more in the body because they do not trigger the immune system. Also, the surface of these nanoparticles could be modified in a way to have better tumor targeting properties. Last but not least, the lipid nanoparticles that we're using have inactive prodrug docetaxel. When these lipid nanoparticles are uptaken by cells, the intracellular enzymes inside the cell break down the lipid nanoparticles and releases the drug. So we have done an in vivo experiment in which we took NeoPaca to pancreatic cancer cell lines, and we subcutaneously implanted them into mice. We divided the mice into different groups. One group only had gold nanoparticles. The other group had gold nanoparticles with free docetaxel. And then the final group had gold nanoparticles with lipid nanoparticle docetaxel prodrug. The docetaxel dose that we used is roughly a quarter of what is currently being used in clinic. That is if we converted the dose from mice into humans. The goal of this experiment was to see how the lipid nanoparticles affect the gold nanoparticle uptake and retention compared to free docetaxel. And the results were really promising. We found out that the tumor tissues that had lipid nanoparticles accumulated roughly double the amount of gold in them compared to control cells. We also found out that over time, the tumor tissues that had lipid nanoparticles in them with gold accumulated also roughly double the amount of gold in them over time compared to the control cells. We verified that visually as well using dark field images. We did not find any significant difference between the lipid nanoparticles or the gold accumulation using lipid nanoparticles and the gold accumulation using free docetaxel. This is really promising as it shows that we could potentially substitute the more toxic free docetaxel with the lipid nanoparticle docetaxel prodrug. In conclusion, pancreatic cancer is one of the worst types of cancer you could ever get. We are proposing using gold nanoparticles, lipid nanoparticle with docetaxel, and radiotherapy for the treatment of this type of cancer. For future experiments, or our next experiment is going to be to see how lipid nanoparticle docetaxel prodrug affects normal tissue toxicity before we proceed to using radiation with lipid nanoparticles and with gold nanoparticles. In the end, I would like to say that despite how deadly pancreatic cancer is, there are always people behind the scene who are working really hard to find the new treatments for these types of cancers. So there's always hope. Thank you so much for listening.
Great. Thank you, Ze, for the presentation. I am now pleased to open the floor to questions from the audience. You are all presently on mute, so to ask a question or join the discussion, you have to use your control panel to either raise your hand to speak or to submit a written question. Marshall, do we have any questions so far?
Presently, no questions. Oh,
Okay.
wait, I spoke too soon. Someone raised their hand.
Perfect.
Sirazam Munira, sorry if I've mispronounced your name. I'm allowing you to talk. If you want to unmute yourself, you should be able to speak now.
Thank you for giving me the chance to ask. Thank you for your nice presentation. It was really great. So my question was more of a technical term. Could you explain how did you prepare your lipid nanoparticles?
Oh, the lipid nanoparticles?
Yes. So
the lipid nanoparticles, that kind of information I cannot reveal in this presentation. We are cooperating with a company,
okay,
to create these lipid nanoparticles. So I cannot go into a lot of details into how.
Okay, yeah,
them.
okay, that's okay. Thank you.
I apologize for that.
And no other questions at present.
No other question. Okay, I could ask you a couple of questions, if that's
Mhm.
okay, Zach. So
Yeah.
it's actually, there are two questions that are combined, let's say. So the first one will be, what is the size of the gold nanoparticles that you use? And the second that is linked to that will be, can you use either larger or smaller nanoparticle, and will it be any impact on the distribution of those?
Yeah, that's a really smart question. So the size of these gold nanoparticles is roughly between 10 to 15 nanometer in diameter. And the reason behind using this size, so we have done multiple experiments using smaller sizes and larger sizes. We found out that these smaller sizes have better penetration and better reach to the tumor when we used 3D models and when we used some in vivo experiments previously as well, compared to larger nanoparticles. So this was like the sweet spot of finding how the nanoparticles would reach the tumor, and also how we functionalize them as well. So these nanoparticles are functionalized with PEG molecule, which helps the nanoparticle have better circulation in the body. And they're also functionalized with RGD, which helps them have better tumor targeting. Hope that answers your question.
Yeah, that was a great answer. Thank you so much. Marshall, do we have other questions?
In fact, yes, I see a hand is up. 1 second.
Thank you.
Oh, it's Sirazam Munira again. I've allowed you to speak, so please go ahead.
Yeah, thank you. So I have another question, that is, was there any other method that that you were confirmed that the docs was actually within the pocket, other than the electron microscopy pictures that we saw, the images from electron microscopy? Other than that, was there any other method that confirmed their presence inside the lipid nanoparticle pocket? That was my question.
Yeah, that's a good question. So experimentally, again, I guess the way to verify that was through the results, though. The fact that, because we used lipid nanoparticles with gold nanoparticles, and we used gold nanoparticles by themselves, and we used pre-docetaxel by itself as well with gold. And the accumulation of gold did increase roughly to the double when we use the lipid nanoparticles. And we know that that happens due to the effect of the docetaxel being inside the cell, basically, by affecting the microtubules inside the cells. But in terms of another way to verify that docetaxel is inside the pockets, I mean, other than the photos, I currently don't have that piece of information, but I could definitely look it up, and we'll get back to you for sure.
Yeah, thank you. Because it might sometimes be tricky from the electron microscopy imaging, that is it really the docetaxel, the drug inside the pocket, or something else? It might be an artifact also. So yeah, there is always good. It's always good to have something else to support. But yeah, thanks for your explanation. That was great.
Thank you for the questions.